Hello, everyone. My name is Rebecca Bainval. I'm a member of the Health Professionals Network Committee. Thank you so much for joining us this evening. Tonight's event is hosted by two of our professional networks, the Legal Network and the Health Professionals Network. Thank you to our chairs, Debbie Graboff, Andrea Sonnenberg, Dr. Robin Polanski, and Dr. Michael Hotchman. And thank you to our presenting sponsor, City National Bank. We are thrilled to be able to offer our programming to the broader community, allowing more people to have access to this very important content and that we'll be sharing with you tonight. If you're interested in learning more about any of our 6 professional networks, we'll share that in the chat and in the thank you email that will follow up with this event tonight. Our speakers tonight are Rabbi Jason Weiner, Director of Spiritual Care at Cedars-Sinai, Jessica Sibony, an estate planning attorney and member of the Legal Network Committee, and Kathryn Petit, a life care planning consultant with Kaiser Permanente. But first, we will hear from Andrew Kushner, Executive Vice President, Donor Relations at the Federation, to share about the important work and impact of the Federation during this time. Thank you. Enjoy.
Good evening, everyone. Good evening, everyone. Thank you, Rebecca. It's my pleasure on behalf of the Federation professional team to welcome you to this evening's seminar. I'm thrilled that we're able to do programs like this that give people a chance to reflect at a time when we have time for reflection. No one anticipated a moment like this ever in our lives, and hopefully we're able to make the best of it. The Federation's been trying to accommodate people's needs with programs like this. We've also done programs for families with young children, for young adults. We've done everything we can to keep Jewish life alive in this city for people who are seeking opportunities to engage. We also, as you all would expect us to do, have been very active in supporting people's social service needs. Prior to this horrible crisis, we had built an infrastructure of programs to take care of people most in need in our community, and we mobilized that network to respond to the overwhelming need that has now come before us. We've been giving grants to people to pay their bills. We've had over 200% increase in the amount of people coming forward with requests for those services. We created a special loan fund for members of our community to get access to interest-free loans. We've bulked up the amount of social service hours we have so people can be with social workers. Basically, we have pivoted the entire Jewish Federation in order to respond to this crisis to make sure our community has what it needs. If you need help, we're going to post up in the chat the phone number that you can call or you can give to somebody else if they need help. We are eager to help people. It's a warm line. It's not 24 hours a day, but during the entire work day, anybody can call and get help if they need it. And that help, again, can be cash assistance, social service assistance, counseling to help people with their nervousness and their stress, all of the things that people might need in this terribly challenging time. Sadly, in addition to the things I have mentioned, we also actually have had to add funds to our Jewish Free Burial Fund. We recognize that at this time, some people can't afford to handle those kinds of things for their families, and there's more money available for that if people need it as well. So basically, any need that is brought about by this COVID crisis, we're there for the community. I want to pivot, and actually thinking about the burial fund is an interesting way to leverage that. I want to pivot to talk about tonight's programming. We are giving you an opportunity to reflect on your legacy, on your well-being, on the things that matter to you most. And one of the things we're grateful for at the Federation, like most nonprofit organizations, we receive many, many bequests from people that help sustain us. In fact, throughout this crisis, we are being sustained by bequests that have been given to us in the past. So as you think about your life and your legacy and all of the important things we're going to be discussing tonight, think about your philanthropic legacy. Think about what you care about. Think about what you might want to support in the future, even after you're gone. And think about the Federation in that guise. You will also see information about my colleague, Betsy Berger, who leads our planned giving efforts. And if you have any specific questions about estate giving to us, you can ask her. And I'm sure the panelists tonight will be able to give you guidance on estate giving generally. Lots and lots of people do give to charity in their estate plans, and it's something that you should think about. Thank you very much again for being here. Thank you for all of the panelists for their time and thoughtful preparation. It's now my pleasure to introduce my friend and colleague, Rabbi Jason Weiner, who will talk about ethical wills.
Hi, thank you so much, Andrew. It's great to be with all of you. My name is Jason Weiner, and I'm the rabbi at Cedars-Sinai Medical Center. And truly an honor and a privilege to be here with you all. I'm a huge fan of the Jewish Federation of Greater Los Angeles. I see the incredible work that they do all the year round, but when crises hit, they're the first place we turn to, and they really step up in an incredible way. And I've seen that during the fires we had and the floods and right now. And so anything we can do on behalf of the Federation really, I think is a huge mitzvah and so important. I wanted to talk to you about something tonight that is really important also at all times, but moments like this give us an opportunity to reflect on them. They're difficult topics, things that people don't often like discussing, unfortunately, because they're things that have to be discussed. And I'll share why. Maybe I'll share why with a story in my work at Cedars-Sinai. When I think about ethical wills, the first thing that I remember is a situation that we had, and I apologize, some of this is difficult to talk about, but like I said, it's important and it's really uplifting at the end of the day, even as depressing as it sounds initially. I remember a woman who I was asked to see as a chaplain in the hospital who was suffering from very severe depression. She had every right to be depressed. She was in her 30s and she was diagnosed with a terminal illness and she was dying. And she had a small daughter, just 2 years old. And she was really upset and they were trying everything they could, all kinds of antidepressant medications, and nothing was working. And as a chaplain, when I was asked to see her and I began talking to her, our role is to listen and to help people emote and kind of express what they are feeling. And so when I kind of asked her to articulate what she was suffering from, she said, the number one thing that she was feeling at that moment, the number one struggle was the fear, the concern that her young daughter would never know her mother, never know who she was, what she stood for. So we had this idea. I said, first of all, let's make a video so that she can have a chance to see you and you can talk about yourself and your dreams for her. And let's create a document, an ethical will, which we'll discuss tonight. And we did that. And it was really profound and beautiful. And actually, her depression symptoms lifted. She didn't become happy-go-lucky, but she began participating with her care once again. She began sleeping at normal intervals, eating normally, kind of functioning again. And unfortunately, she only had a few more months left, but she had this incredible gift that she gave to her daughter. And it really was a gift. It really got her motivated once again. And so this, an ethical will is not like a modern, technique that we just came up with in hospitals and chaplaincy. This is actually one of the most ancient spiritual traditions that we have in Judaism. We know that Yaakov in the Torah does this with his sons before he dies. He brings each one of them and gives them sort of his message, his mission to them before he dies. King David does this with Solomon right before he dies, a very moving chapter in the book of Kings where he describes, what he stands for, what's most important to him, and he gives that to David. David gives that to Solomon. And the truth is, it goes throughout our tradition. There's a famous, the Ramban, Nachmanides, gave an ethical will to his children, his tzava, they call it. It's actually a very profound document. The Baal Shem Tov, the founder of the Hasidic movement, did this. It's a tradition we have throughout Jewish tradition, the Sefer Hasidim. And there's actually a saying in like sort of Kabbalistic literature that if a person prepares for their death, prepares for what's to be beyond them, whether that means their burial plot or documents that have to do with their end of their life or after, it's what we call in Hebrew a segula for richat yamim. It's a charm for a long life. Now it sounds funny to say, like, we're not going to do like a double-blind, research study in the hospital on, if people who have advance directives and ethical wills filled out before they die actually live longer. I'm not sure that you would be able to find any support for that. But what I think it means actually is not that they live longer, but that if you look at the words in Hebrew, what it really means is arichat yamim, means they'll have longer days. And I think what longer days means is that we appreciate every moment. When we recognize the fragility of life and that our days are numbered, it teaches us, as it says in Psalms, to appreciate every moment that we have and make the most of it, because we have only a certain amount of time to accomplish in this life, and therefore we have to make the most of every day, no matter where we are, what we're doing. And by having these conversations, it helps us to appreciate the fragility and the importance of making the most of every day. And so what I want to do with you for just about 9 minutes is to give you an overview of what it would mean to fill out an ethical will. If you have with you right now, either you could open a Word document or take a pen and paper, and I'm going to walk you through it in a very kind of overview way. What I sometimes do, I've done this with some federation groups and with some chaplaincy groups, we sometimes do this in an hour-long workshop. And the truth is, if we have more than an hour, that's even better. So obviously what we're going to do right now is not the full experience, but I'll give you a taste of it. And then actually I can put in the chat afterwards, I can put some contact information if you want to have, if you want to go more in depth. But this is the basics. I'll give you basically the prompts. What we do is I give you some writing prompts, and we give you some time. You write down the prompts, and then I'll go over with you how you would then create an actual ethical will for your loved ones afterwards. So what I'll do now is actually give you the prompts. I'll ask the questions, and instead of giving you 5, 6, 7 minutes as would be appropriate to write them down, I'll just give you a few seconds, but at least enough time to write down some initial thoughts. So as I give you the prompts, write down your thoughts. And again, what we're doing here is thinking about what matters to you, what your lessons are, what you've learned in life, what your spiritual, emotional legacy is, what you want people to know about you, what you think is important. And the truth is, it's a gift for you as well. Even if you don't have in mind, I'm writing now for my grandchildren or for my partner or for my parents or whoever it might be, it might even be for yourself. And God willing, every 10 years or so, you might even want to update this or share it with your loved ones, because it's really a profound document and a great opportunity to sort of think about things that we don't often take time to really think about and slow down, as Andrew mentioned, to have these ultimate conversations. So I usually break it up into about 4 sections when we create our ethical will. The first section of creating an ethical will is to sort of list the principles, the key important concepts that you want to convey. What are the most important things that you've learned in your life? You don't have to share this with anyone else, but of course, there's a power to writing them down. And so if I were to ask you, for example, just to think and try to articulate, try to write it down. It's better to write it down than to actually think about it, because it forces you to put it into words. Is there like one lived truth that you know and you'd want to communicate? Like one lesson, one important key principle? Maybe think about like Pirkei Avot, the ethics of our ancestors, where they list the great rabbis and they're like one message. It's sort of like your yearbook quote. Is there something that's like your key lived truth? If so, try to write something down. I know it's not easy, but write something down that comes to you in that moment. And then as a gift, as a way of kind of helping people just sort of to know who you are and what you stand for, and to make yourself reflect on it. And I think it's an easier question. Is there a most meaningful religious holiday to you? Of all the holidays, especially Jewish holidays, is there one that is the most meaningful to you, and why? What's most profound to you on the Jewish calendar? And how about a Jewish tradition? Or it could be any tradition. It could be that it's, New Year's or Memorial Day, whatever it is. Is there a tradition that you do every year or every night? Maybe it's saying the Shema before you go to bed or something like that. Is there a tradition that you have that's important to you and that means a lot in your life and is most meaningful for you? And how about a memory? Is there a Jewish memory in particular, but it could be spiritual, meaningful, anything. It doesn't have to be Jewish, but a spiritual or meaningful memory in your life, either growing up, whether it's the Passover Seder or a Thanksgiving dinner or a graduation or whatever it might be, a most meaningful memory in your life. And now this really comes back to the first question, but it's just another way of saying it now that you're thinking a little bit. Would you be able to distill the essence of your spiritual tradition? Meaning, like some rabbis said, love your neighbor as yourself. That's the essence of Judaism. If you could summarize the essence of Judaism or religion or spirituality or ethics or meaning in life, how would you distill it? Like in one sentence, what is the main thing? What does it all come down to? Family, love, friends, giving. Could you distill the essence of your spiritual tradition? And if so, write it down. Write something down. And then, whereas the focus on those first questions is to list the principles, the main key ideas that are crucial to you. And that really is a gift to your loved ones, but also to yourself to make you appreciate it, help you appreciate it more. Now we start thinking about your wishes. Are there things that, what you wish for? And in particular, I begin now thinking, like, do you have a personal 10 commandments? So I just asked you to list the key essence of your spiritual tradition. But what if you were to write your own 10 commandments? So, okay, we're not trying to say that there's something more important than the 10 commandments. I am the Lord your God. You shall have no other God. Keep the Sabbath. Honor your mother and father. But if you were to write your own 10 commandments, not to replace the 10 commandments, but what are your 10 commandments? Are there things that you think the world would be a better place, or your life would be a better life, or your family would be a better? If you had 10 commandments that you could say, these, in my opinion, are the key things to making a good society, living a good life, what are your 10? Could be 3, could be 5. And then we go from there and say, okay, now that you've said a lot about what you think is important, let's go back. What's something that you've learned from your grandparents or your parents or a partner or a spouse or a sibling or children, but something you've learned, or a best friend, something you've learned from others in your life? That's a key teaching that you've learned from someone else. If you could think of something that you've learned from another person that you think is key information, put that down now. And then in addition, and I know I'm going quickly, but I just want to give you the overview of the feel for it. Just because I want to wrap up in the next couple of questions. But okay, so you put something, hopefully, that you've learned from another person in your life, an important person, a family member, a friend. What about experience? Is there something you've learned from experience? Just experience has shown me, experience has taught me X. And just fill in something you've learned just throughout experience in your life that is an important, valuable lesson you'd want to share with others. And then as we begin to conclude, are there some, struggles, obstacles that you've learned from in your life? If you only had a limited time left to live, is there something you regret not having done yet? What do you regret that you have not yet accomplished in your life? And as you think about failures or struggles in life, so the next question would be, what have you learned from your failures or your struggles in life? What's something that struggles have taught you? Is there a message, something you've had to overcome, something you do differently? And then finally, and I hope you can really take a second to write down about this one, because this is really important. How about the miracles of your life? What do you have gratitude for? This is a really important space to put your mind into. Just to write down something you're grateful for in your life in general. What are you grateful for? What would you not be the same today? What would your life not be the same if it was not for this? Something you're grateful for. Ideally, more than one thing. How about something that makes you happy? Is there something in your life that makes you happy? Something that just always, someone or something or some place that really makes you happy. That's an important thing to write about. And then finally, maybe some hopes for the future. So I hope you take a few moments to write that down. I'm happy, and again, I'll share some contact info in the comments. So you're welcome to email me. Then I'm happy to share this whole document with you, and you could take the time, especially with another person, and reflect on what it's like to write about this and your experience. But the basic gist, and I'll just conclude with this, would be to then take all those different points you've made, collect them, start with an opening, some kind of decide who you're writing to, if anyone. Write a word of praise for them, open, with words of love for them, use your own words, then have the body of your letter, the principles that you've expressed, the struggles, the gratitude, maybe then a blessing for the loved one, and close, with words of love for them. That's the basic gist of an ethical will. It's an ancient Jewish tradition that's survived to our modern day. People still do this and find tremendous spiritual enhancement and growth and gratitude in this. And I can tell you, not only is this incredibly life-changing to take the time to write this out for yourself and to experience this, and it gives you a whole new appreciation for these things in your life, but it's truly a gift for your loved ones. It's truly a gift. Just imagine having one of these documents from your parents, your grandparents, your great-grandparents, to know about who they were, what they stood for, what they learned in life. It's really a beautiful thing that can be a blessing for you and for those yet to come, and for your entire family. So I encourage you to try it out. Thank you for your time. It's really, again, a difficult conversation, but such an important conversation. And now I turn over to Jessica Sibony, who will discuss estate planning with us.
Thank you, Rabbi Weiner. That was really beautiful and really shares and sheds light on the importance of having that as part of some spiritual wills as part of your overall estate plan. If you just bear with me for a second, I'm going to share my screen. I hope everybody can see what I'm looking at. Hi, everybody. My name is Jessica Sibony. I am a estate planning attorney working at Klinger and Elbaz. We're a boutique estate and tax planning firm located in Westwood. I want to spend some time tonight delving more into estate planning on top of a spiritual will, and that's planning for your assets and decision making. So throughout my presentation, I want to shed light on overall estate planning and why estate planning is important, but also what we should be doing right now in light of COVID-19 to make sure that our loved ones are protected and taken care of. Everybody has heard of trust funds, and I think a lot of people have the misconception that I don't need a trust. Trusts are only for wealthy people, and that's not something that I need to do. But the reality is trusts are only a part of the estate plan, and there's some sort of estate planning that just about everybody over the age of 18 should be considering doing. So one of the first things I get asked most often by my friends and family, and most importantly my clients, is why do I even need a plan for when I'm no longer here? I'm not going to be here. Who cares what's going to happen? But the reality is, if you know what might happen if you don't have a plan, that'll convince you to make sure that something is in place. And there's 3 reasons why. Number 1 is control. Without having a plan, you essentially lose control of how your money and your assets will be distributed when you pass away. That'll be left up to California law. So if you have a plan in place, you can shed light and make sure that you dictate how your assets are transferred when something happens to you. Number 2 is decision making. And this is something that goes on during your lifetime more so than on your death. And if you don't have a plan in place and something happens to you and you become incapacitated, there's nobody there to make important financial decisions for you. And having a plan gives you the opportunity to make sure that you appoint somebody that you trust to make the right decisions for you if you need to. And the third, and I think probably the most important, is having an estate plan gives you the opportunity to appoint a guardian for our children. Children are so much more important than our assets, and we want to make sure that somebody is there to take over the care for them if in the unfortunate event something happened. I know it's hard to talk about, but that's the reality, and you'll feel a lot better having some sort of plan in place. So after people ask me why they need an estate plan, I often get, well, I don't have the time to do it. I'll get to it eventually. What happens if I have no plan? The reality is maybe it's not so bad, but your loved ones and your beneficiaries, like your spouse and your children, might have to go through the probate process to get any of your assets. And going to court might not sound so bad, but I want to give you a few reasons why it's not the ideal situation to be in. Number 1 is that probate can be expensive. Having to go to court and hire an attorney to do this ends up costing a lot more money than just having an estate plan in place. And it's just a lot easier to save the money on that back end. And number 2 is probate takes a very long time. Usually it takes about 9 months to a year to get a probate done. Right now, because of COVID-19, we are experiencing court closures. The courts have been closed for 2 months now, and I'm not sure how much longer they'll be closed, and once they reopen, how backed up they'll be. So that means probate's going to take an even longer time. And that might not sound so bad, but if you have family members who are relying on your assets to live on and support, that means it's going to take that much longer for them to get access to it. I just want to share a quick story. About a year ago, I had a client come in who was a young husband with 2 very young kids, and he lost his wife unexpectedly. His wife actually had a pretty significant investment account that they used to supplement their income. And they always talked about getting around to estate planning and getting that asset transferred into both of their names, but they never actually got around to it. And she passed away, and the asset got tied up in probate. The husband actually had a really hard time over that year figuring out a way to make ends meet because there was no way to get the asset to him quickly. We finally wrapped it up earlier this year, and luckily now everything is in his name and he's able to move on and as best as he could and make sure that his kids are taken care of. But when your family is relying on those assets, it's a good idea to make sure that you have a plan in place. And finally, with a probate and no estate plan, like I mentioned before, you don't have control over who gets your assets. California law dictates that. Oftentimes it'll be your spouse and your children if you have a spouse and children. But what happens if you don't? That means your parents might end up your beneficiaries or your siblings. If your parents are no longer living and you have no siblings, that goes down further to family, like your cousins, and might not be people you want ending up with your assets. So it's a good idea to take control and make sure that you can dictate what happens. And there are several ways to avoid probate, to make sure that you choose your beneficiaries, you decide who makes decisions for you, and you decide who cares for your children. So I want to touch on a few different ways of avoiding that probate process and getting your assets transferred. I do want to talk about wills a little bit. I know people know a lot about wills, and we hear that a lot in movies. We see people reading their testamentary wills on TV and movies and TV shows. And a will is a good way to have your wishes written down and dictate what happens. But unfortunately, having a will doesn't actually avoid the probate process. If you have a will, it's great, but it's not the ideal way to get those assets transferred outside of probate. So these different methods that I'm going to discuss really depend on your personal situation. It depends on how many assets you have. It depends on who your beneficiaries are. So these things might work differently for different people. So the first and the simplest way is a payable on death account. And that's usually a great tool for somebody who doesn't have much of significant assets. They have some bank accounts, but no real estate or anything like that. And that entails going to the bank and telling them that you want to name a beneficiary for your bank account. And then the bank will deal with making sure that that asset is transferred and that bank account is transferred if something happens to you. So that's a great option. I think it's a good option for people who are single and are just starting out their careers and maybe don't have anything really that significant. The next thing I want to touch light on is beneficiary designations. This actually applies to just about everybody. Mostly everybody has some sort of life insurance or retirement account. And for a lot of people, retirement accounts are one of their biggest assets. So it's really important to make sure your beneficiary designations are filled out. That means calling up whoever your administrator is, whatever life insurance company or retirement account company you have, and pulling up your beneficiary designation. Make sure that it's up to date, that it has somebody named, and it still is in accordance with your wishes of who you would name today. I'm going to touch a little bit more about that later, because this is something we should be doing right now, is reviewing our beneficiary designations. I want to also talk a little bit about joint tenancy. Joint tenancy is a way of holding title to property, and it essentially means that if something happens to you, the property automatically, by law, gets transferred to the co-owner. So this is a great option for real estate if you co-own property with a partner or a spouse, a family member, and your intent is that they get your share of that property if something were to happen to you. I do want to point out that you can't then control what they do with that asset. It becomes 100% theirs, and they decide what happens to it if they were to pass away. And the last thing I'm going to talk about, I'm going to go a lot more into on my next slide, is the trust. The trust is really the bread and butter of what I do. It's probably the most flexible way to get assets transferred. It's the most important part of your estate plan, and I'll go into it a bit more now. So there's lots of benefits to revocable trusts. Number one is that it's extremely flexible. My husband and I just recently did our estate plan because we have an 18-month-old daughter and wanted to make sure that there was a plan in place for her. And we're still young, our daughter's still young. Hopefully, God willing, we'll have a bigger family one day. And as our needs and lives change and as we grow in our careers, we'll be able to easily update our trust and our estate plan to make sure that our current needs are met. So a trust is great to have right now, but as you get older, as things in your life change, it's an easy way to make sure that your wishes are current. And as I mentioned before, the trust is the best way to avoid probate. It's extremely cost efficient because you have the upfront cost of getting a trust established and transferring your assets into the trust. But after that, the transition from you during your lifetime to your beneficiaries on your death is very seamless. There's no need to file anything in court. It's very private. The person you appoint as your trustee manages the assets with your close advisors and make sure that things turn over to whether it's your children, your spouse, your family members, pretty seamlessly. Another reason revocable trusts are a great tool is because it really gives you the opportunity to be thoughtful about your beneficiaries. A lot of the times people want to leave the bulk of their assets to one person or a group of people, like their children, but they also want to make sure that their other loved ones are taken care of. Oftentimes I get clients asking for their trust to reflect specific gifts or small gifts to nieces and nephews or their friends to show their appreciation. And it's really simple to do that in the trust. And like I mentioned before, as those people in your life change and as other people enter your life, those things are really simple to change and update. But it's a great way to make sure that who you want to take care of is taken care of. Having the trust also lets you put conditions on how and when your assets are distributed. I'm just going to focus on children because I think a lot of people have children, and even if you don't, you can think about it in the context of other family members or loved ones that you leave money to. What I mean about conditions is it gives you the opportunity to control when they get access to their money. So if you don't have a plan in place and you're going through the probate process, your children end up inheriting all of your assets at 18. And let's say you just own a house in Los Angeles. That alone might be, upwards of $500,000 that you'll be handing over to an 18-year-old to manage. Some 18-year-olds are very well capable and financially savvy enough to be able to handle that, but a lot of them will likely not be using that money the way you intend. So having it in the trust allows you to make sure that it's managed for them and spent for them on things like their support and education, and then lets you decide what age they get the ultimate control. That might be 25 or age 30, and the ages really depend on your personal situation and your children. And again, having it in the trust provides a lot of flexibility. Myself, my daughter is only 18 months old. I have no idea what she'll be like when she's 18 or 20. Hopefully she'll be smart and savvy, but the reality is I have no idea. So as she gets older and I get to know her better, that might be something that we reconsider in terms of deciding when we turn over ultimate control to her. And finally, with the trust, which is what Andrew Kushner spoke about earlier, is it gives you the opportunity to do some charitable giving. And that might mean making sure that some endowments that you made during your lifetime are fulfilled, but it also might mean giving more substantial gifts to charities that you supported during your lifetime, but also want to make sure create a legacy for you after your death. And it might be small gifts of money, it might be larger sums, but it's a great way to plan to give to one charity or more. Hopefully the Jewish Federation. It's an organization that I love and I'm a part of and support. So overall, it's quite clear that having a revocable trust is a great tool, and I'm sorry I glossed over it so quickly, but I hope that provided some good information. Next, I want to talk about the decision-making aspect. And I mentioned before, that's something that more so happens during your lifetime. We're living in really scary times right now. People are getting sick all over the place. Luckily, LA hasn't been so bad, but our loved ones are fellow citizens. They're in the hospital. They're unable to make decisions for themselves. And if that happens, we want to make sure that there's somebody that we trust to fill into our shoes to make decisions. And by decisions, I mostly mean financial decisions right now. Those financial decisions include things like signing checks, entering into contracts. Maybe it's selling your car. It's contacting unemployment and banks and other places that you might have contact with on a regular basis to make sure that all of your financial affairs are in order on a day-to-day basis. So I think it's one of the most important tools to have in estate planning, if you have anything at all. People often ask, well, who needs a durable power of attorney to appoint an agent for financial decisions? And my answer is, if you're over 18, you should probably have one. In fact, I have a lot of clients who will call me a few weeks before their kids are leaving for college and say, well, my child's leaving. Is there anything we should be doing? My answer is, you should be doing a durable power of attorney for financial decisions, and also a healthcare directive, which Kathryn Petit will get into on the next presentation. Lastly, I want to talk about our children. My daughter is, like I said before, more important than any of my assets. And the number one reason I created our estate plan for my husband and I is to make sure that there's somebody there to care for my daughter the same way I care for her on a day-to-day basis. I'm not gonna lie, this was probably the hardest decision my husband and I had to make. It's really surreal and weird to think about somebody else having to care for your child when you just want to be there and see them grow up. Hopefully this never has to happen, but it was important for me for us to think about that. If you don't have a plan in place, California courts will ultimately decide by looking at what's in the best interest of your child. But when you have a guardian nominated in your will or in your estate plan, that at least gets your opinion in front of the court and says, hey, court, I think this person is going to do the best job and knows my child well and will care for my child the way my child should be taken care of. I say child because I have one child, but this applies to obviously all of your children. So what I'm talking about here is a guardian of your child's person, and that means they care for your child's day-to-day decisions. The financial side is more dealt with in the trust, like we discussed earlier. And those just day-to-day decisions include things like, where is my child going to go to school? Is he going to the private school or the public school? When is my child brushing his teeth? Making sure his homework gets done, making sure he's not eating ice cream for dinner, things like that. It's really the overall physical and emotional needs of your child and providing a home for your child. So like I said, it's probably the hardest decision somebody has to make, is deciding who should take care of your child, because the reality is there's no one better than you to take care of your own child. But there are some things that I want to point out on how to decide who is the best guardian for my child. Number one is, it's absolutely important to discuss it with your partner or your co-parent, and that you're on the same page about who that guardian will be. And you should be looking at things like the potential guardian's values, their family dynamics, whether they have children of their own, are they able to take in another child or children, where they live. If you have an older child, you might not want to be naming a guardian that is on the East Coast when they live here in Los Angeles and have their lives already established here. And finally, I just want to mention that it's very important to discuss with your potential guardian the fact that you're appointing them. It's definitely an honor to be named a guardian in somebody's estate planning documents, but it could also be a huge burden on somebody. So you want to be sure that whoever you're thinking of is up for the challenge of being your child's guardian. So now that I've talked a lot briefly about why estate planning is so important and the types of decisions we make in estate planning, I want to highlight what we should be doing right now in light of COVID-19. I think we're on week 10 now of being home because of this pandemic, and it still feels surreal to me every day, even though it's been a couple of months now. But there's definitely a lot that we should be doing and thinking about right now in terms of our estate planning and getting our affairs in order. Number one is that even though we're social distancing, even though we're under stay-at-home orders, estate planning is still possible to be doing. Myself and other attorneys I know of are fully operational, working from home, whether that means meeting clients over a Zoom conference like we're doing here or over the telephone. Making sure that estate plans get drafted is still possible. Somebody in their questions asked, well, what are you doing about signing these documents? And my answer is kind of twofold here. Unfortunately, California hasn't jumped on that remote notarization bandwagon yet. Hopefully we will soon. But at least as long as you have an estate plan in place that's signed, even if it's without a notary, at least that's better than nothing, is my answer to a lot of my clients right now. Just get it signed. When the stay-at-home orders are lifted, we'll revisit it, make sure that it gets proper notarization. But also, if you feel comfortable, there's a lot of traveling notaries that they're going around, they're being extremely safe and making sure that documents get signed according to the law. Next is reviewing beneficiary designations. I mentioned that earlier, but I think this is probably the easiest and simplest way to make sure that things are in place while you're home as a result of COVID-19, is making sure that you have somebody named in your beneficiary designations for retirement accounts and life insurance, and B, that person still makes sense, or those people still make sense. If you filled out your designations several years ago, you might have different people in your life that you want to be taking care of. So please revisit those, make sure they're up to date and make sense with where you are in your life right now. A lot of you might be saying, well, I already have an estate plan, I guess I don't need to do anything. Estate plannings can get stale. Like I said before, our lives change, we get older, our children get older, our careers change, and the law changes. So it's a good idea to revisit your estate plans every several years to make sure they're up to date, that they still reflect your current intentions. And there's no better way to be doing that than right now, given the situation that we're in, and making sure that it's up to date and reflects your current desires. Everybody should also consider getting some sort of life insurance in place, especially if you're young. Life insurance is a really simple, and if you're young, inexpensive way to provide some extra financial security for your family. Things are happening unexpectedly right now to a lot of people, and having that life insurance is just a good tool to have. Finally, I want to touch on talking with your parents, your grandparents, and your other loved ones about their estate plans. Make sure that they have a plan in place, that you know what their desires and wishes are, and that they're doing whatever they can to make their wishes known and to be avoiding any potential tax that might be due. So again, sorry that I glossed over everything so quickly. I hope you found it informative and helpful, and I hope it gives everybody something to think about in the coming weeks and days while we continue sitting at home. Apparently, potentially until July 4th is what I heard now. And I'd like to now introduce Kathryn Petit, who's going to be talking about life care planning.
Great. Thank you so much. I really appreciate that, Jessica, and that was incredibly important information that you just shared with us. So I'm going to go ahead and share my screen. And you all have received a California Advance Directive that was sent out in the email to you to invite you to this meeting this evening. So before you fill that out, my process is to walk you through a reflective process of your own, so that you'll be able to reflect on your goals and values, which can create a more meaningful document for you and for your loved ones as well. So this process we'll go through right now is walking through, how do you choose a healthcare decision maker who's well informed, who really knows your wishes well? And then we'll talk about how your individual past experiences can really resonate today and possibly influence you. And then I'll have you think about any personal, cultural, or religious beliefs you may have that could also influence treatment decisions. And then we'll talk about some goals of end-of-life treatment decisions that are on the California Advance Directive. So let's explore first, how do you choose a well-informed healthcare decision maker? These are some qualities I'd like you to think about if you've chosen a healthcare decision maker, or even if you're thinking about your potential healthcare decision maker. So first and foremost, they agree to be your decision maker. It's really good to know that now, because it may be too emotional for someone. It may be too much. That's okay. That's great. Know that now, and then you can go to plan B, choose someone else. And then you really want to choose someone and communicate with them often, so that they really know your healthcare wishes well. I think my screen is not being shared. So let me try it again. So I apologize for that. Let's try this. And Leah, please let me know. Great. Are you able to see my screen now? Great, beautiful. Apologize for the technical difficulty. So going back to thinking about who your healthcare decision maker would be, and again, the qualities to consider, it should be someone you trust, someone who would honor your wishes and your values, even if it's different from theirs. And if something were to happen to you, it would be a crisis in your family and your support system. It would be difficult, it would be emotional. So are they able to honor your decision, make decisions in difficult situations? I want to talk a little bit about who can and who cannot be your healthcare decision maker. So it has to be an adult, 18 or older. It could be your spouse, domestic partner, same-sex partner, someone in your family, a cousin, an aunt, a good friend, or perhaps it's a neighbor you know really well. Again, reflecting on those qualities, they know your wishes well, you've talked to them frequently, and they really understand what you want. They can honor your decisions even if it's different from theirs. And they can uphold your decisions during a difficult time. I want to talk a little bit about who cannot be your healthcare decision maker. So it cannot be a physician who's providing care for you. If you have Blue Cross, if you have Kaiser Permanente, your primary care physician, or if you have a specialty physician you see, they cannot be your healthcare decision maker. Also, if you reside in a residential care facility, perhaps a boarding care, a nursing home, the person who owns that boarding care or that nursing home, or folks who provide care there, also cannot be your healthcare decision maker unless they're related to you by blood, by marriage, or by adoption. It's also important to know that there's no next of kin law in the state of California, so it doesn't automatically default to a spouse, let's say, or your oldest child, your oldest adult child. So again, really thinking about those qualities of who a well-informed healthcare decision maker can be, can really, really help you choose that person who you trust to really honor your decision, especially in those difficult moments. And hopefully this will not happen, but it's good to have this gift for your family. So let's talk a little bit about some responsibilities your healthcare decision may have. They may make choices about your medical care. If you're unable to communicate, again, this is that what if scenario. Something happens, you can't communicate. They can release your medical records, arrange for your care. They can also decide, which healthcare providers would provide treatment. Maybe you have a favorite physician, and it's really important to you that that physician is providing your primary care, your specialty care. So they can make that determination. And then if you should require an autopsy, they're able to legally arrange that if that's needed as well. So bringing up a conversation can be challenging. We offer this workshop to a lot of people throughout Southern California, and oftentimes some feedback we get is, I tried to bring it up to my husband, to my wife, and they said right away, no, don't say anything because it means someone will die if you bring this up. The other shoe will drop. So there's a lot of misconceptions. There's a lot of beliefs around the topic. So we want to dispel those, right? And we want to give you some tips to think about, how do we start this conversation? You may share that you were joined this meeting this evening and it got you thinking, right? Would you be willing to talk to me about being my healthcare decision maker? Just opening it up like that, right? And would you be comfortable honoring my wishes if they're different from yours? And it would be really difficult if something happened to me. So can you make decisions during a difficult emotional time? These questions are something to help you as you approach your prospective healthcare decision maker. And also it's really important for them so that they can understand roles and responsibilities, and are they willing to do it? Are they willing to accept this role? So just a few things to think about as you start your conversations with your loved ones. So what if you decide not to have a healthcare decision maker? Great, no problem. There's not a law around choosing a healthcare decision maker. We recommend it. We do recommend that you choose one, but perhaps for whatever reason you say, no, I'm going to keep this private. Great, no problem. All the more important reason to write your wishes down in your Advance Health Care Directive, so that you can get that as your communication tool to your insurance provider, your primary care physician, whoever you have that provides care for you, and share that document. so that your medical team, your medical providers will know what your treatment preferences are, and they'll be able to honor your wishes based on your values and your beliefs. So now I want to move into how your personal experiences and your personal goals and values really can influence you as you move forward in filling out your Advance Health Care Directive. And I'm hoping that this process will be a one that is of reflection, so that when you fill out the document, it's a really meaningful document that is a rich byproduct of your reflection process, and really is a gift to your family and your loved ones. So let's take a look. I mentioned past experiences and how powerful they can be and resonating today and influencing types of care, not only that you may want, but also types of care you may not want, right? So I ask that in your process, you think about experiences you may have had with perhaps family or friends who became critically ill, and decisions had to be made around life-sustaining treatment. Even think about stories in the media, and I'll share a story where I believe it was last summer, Luke Perry, who was an actor, 52 years old, had a massive stroke, and he was placed on a ventilator on life support, and his family was at his bedside. It was really, really tragic. He's a young man. And he had done his planning, and he had written his wishes down, and his wishes were to be allowed to die a natural death. So the family were able to take him off the life support so that he was able to pass and his wishes were honored. It was a difficult time for the family, of course, and the grieving process is enough, but they were able to honor his wishes knowing what he wanted. About 2 months later, the director, John Singleton, also had a massive stroke. He was 50. And these are all per media reports. He was also had his family at bedside, and unfortunately hadn't done any planning, which, this is easy to procrastinate on. I've been guilty of it myself. So to no fault of his own, he hadn't done any planning, and there was conflict that arose in his family of whether or not to keep him on the ventilator versus take him off the ventilator and allow him to die a natural death. So two very different experiences there, where the family for John Singleton really had to go through a complicated process because of the conflict, which complicated their grief. And so this is, again, something that can be a gift to your family, even though it can be challenging. It can be a gift because grieving is challenging enough. So again, thinking about how your experiences could impact healthcare decisions for you. Another component of the reflective process is really thinking about what gives your life meaning. This can change over the course of a lifetime, right? Quality of life to a 25-year-old who maybe is a triathlete who can't imagine a life-threatening illness. It would be different to someone who maybe recently retired and enjoys spending time with family, walking the dog, going to dinner, great. Or maybe now you're 90 and you're bedridden, but you're able to spend time with your grandchildren, and you're able to listen to music together and watch movies together. And so you're bedridden, but you're still with the people you love. So that's what gives your life meaning. So again, this will change throughout the course of life, and something to reflect upon as you fill out your advance directive, as well as thinking about physical or mental abilities, really important to you, so you can imagine living without them. And I can't emphasize enough the communication and conversations that you can have with your healthcare decision maker and the people that you love, so that they really understand what gives your life meaning. So I wanted to touch also in this reflective process, spiritual and religious beliefs you may have that could influence medical decisions. If I'm a Jehovah's Witness and I am advised against blood transfusion, it's really important that my healthcare providers know that, so that my values will be honored, my wishes will be upheld. So that's something I would want put down in writing in my Advanced Health Care Directive. And so any kind of religious and cultural beliefs that you have, you can also document in the Advanced Directive, even if it's certain prayers you want at bedside, music that you really love that's important to you. You can write that down as well. Thinking about who do you turn to in terms of the people you love who support you when you're making medical decisions, right? And how are healthcare decisions made within your family? Can also be something that will influence you in terms of what you want to write down on the Advanced Healthcare Directive. Great. So now I want to go into a page on the Advance Directive that you've all received that actually helps you walk through different treatment goals in a scenario where you have an incurable and irreversible condition. And it will result in death within a relatively short time. You become unconscious, and to a reasonable degree of medical certainty, you won't regain consciousness, or the likely risks and burdens of the treatment interventions would outweigh the expected benefits. But something to think about, because this is on the document and can really be helpful for your loved ones, because again, this is a communication tool. So for you as individuals, what does this mean? What does this situation mean? And it'll mean something as individual as everyone who's joined the call this evening, because we all bring our own personal experiences to the table. And there's no right or wrong. It's really what's right for you. So thinking about, would you want life-sustaining treatment to continue under these circumstances, or would you want to be allowed to die naturally? And as you can see, this is a page from the Advance Directive that's been sent to you that some people want to write a lot more, right? So they can write down more wishes and more details on additional sheets of paper. Please be sure that you write your name, your medical record number, all your contact information, so that when you put your additional papers with the Advance Directive, they stay together. It's really important. And I'll talk about who you can turn that into shortly in our presentation. Now, in light of the COVID-19 pandemic, I just wanted to touch base and encourage all of you to think about people you love that may fall into the high-risk population of contracting the virus and perhaps having severe complications from this virus. We know that it's wreaking havoc on older adults, 65 and older, especially folks in nursing homes. And so when we think about this information was pulled from the CDC back in March. So these numbers have probably grown exponentially, and we haven't seen any updates on the CDC website. But again, those older adults are hospitalized, they're in the ICU, and unfortunately they're passing away from COVID-19. So as you think about this high-risk population, if it's someone you love, or perhaps it's yourself, I'm so glad that you joined the call so you can think about this and choose that well-informed healthcare decision maker, thinking about treatment based on your values, your beliefs. Again, we mentioned our older adults, nursing home residents, folks who have chronic lung disease, folks who have moderate to severe asthma also are at risk of contracting the virus. And people who have serious heart conditions or who are getting cancer treatment, perhaps radiation, chemotherapy, and their immune system may be compromised as a result of their medical intervention. And also folks who are severely obese or they have underlying medical conditions, especially if they may not be well managed. So thinking about folks with diabetes, folks with renal failure, liver disease. If someone you love falls into this high-risk population, you may want to start a conversation with them. It's important for you to know what their wishes are based on their values and their beliefs, so you can honor those wishes. Now, there was a question that came through, and I was really glad to see this question. What's the difference between a POLST and an Advance Directive? There is an incredible amount of confusion on these two documents, not only with non-healthcare providers, but even in our own healthcare system. There's confusion, even among physicians. So I wanted to just take a moment to differentiate the differences between the documents. So the POLST is a physician's order for life-sustaining treatment. It's a bright pink form. When we think about who can fill a POLST out and an Advance Directive out, the POLST is filled out by social workers, nurses, chaplains. It doesn't become an order until it's signed by a nurse practitioner, a physician assistant, or a physician. The Advance Directive can only be filled out by the person who the document belongs to. Now, here's where it's really different. The POLST is specifically designed for someone who's seriously ill. Very, very sick, very, very frail. And it's not for older adults. You could be 20 years old and have cancer that's metastasized to the brain, and maybe you have renal failure, very, very seriously ill. And you wouldn't be surprised if they were found unresponsive. They ended up in an emergency room. You wouldn't be surprised if they passed away in a year or two. This is really the population, this bright pink form, the POLST, is targeted to. The Advance Directive is for every adult, 18 and older. Thinking about those what if situations. If I have a car accident, what if I have a stroke? What if I get hit by a truck and I'm unable to communicate? So it's preparing for future events, whereas the PULST is something probably will happen. And then it's definitely, as I mentioned, the physician's order for life-sustaining treatment. It's during that medical emergency, right? As opposed to future wishes. And it's easy to find. It's for that seriously ill population. So if 911 is called and EMS comes into the home, the bright pink document is either on a refrigerator or at the bedside of the person. Whereas an Advance Directive, and I'll be honest, I've been guilty of this, was up in my closet with lots of old photos before I was able to retrieve it and send it to my healthcare provider so they could upload it into my medical record. So the Advance Directive isn't always easily accessible, whereas the PULST should be. So I hope that's helpful differentiating between the two documents. There's just still lots of confusion around them. So again, just I can't emphasize enough, please talk to your healthcare decision maker. Even if you choose, let's say, your oldest adult daughter, but your youngest adult son expected to be chosen, it's really good to talk to both of them to let them know why you chose one over the other. Perhaps your daughter is, and I'm just throwing it out there, the calmer one who can make decisions during a difficult time. Maybe your son is a little more upsetting. You know, we all have our different stressor coping skills. So it's really important to just let everyone know so there's no surprises. So you can give that gift to your family, your friends, your physician, your primary care physician, if you have a specialty physician. If you have Blue Cross, make sure they have a copy. If you have Kaiser Permanente, make sure they have a copy. Really, sharing your document is very important in this process. And I believe the rabbi mentioned every 10 years to think about updating your will. So same thing with the Advanced Health Care Directive. We say the 5 Ds, maybe every decade. Perhaps you have a healthcare decision maker who's passed, and so you need to nominate a new one. Or you had a divorce and your ex-spouse was your healthcare decision maker. Or perhaps you yourself have a diagnosis and then a further decline in health. That really has you thinking differently about types of treatment you would want and types of treatment you wouldn't want. So it's really good to just use this maybe as a guideline. It's not just a one and done document, but to really take that opportunity as we go through different phases of life to update so that our wishes are reflective of now and can be honored by those people we love. So again, just in terms of making the document legal, and Jessica touched on the challenges we have with our social distancing guidelines and COVID-19. In order to make the document legal, you have to have it signed by 2 witnesses. One cannot be the healthcare decision maker, and you can only have 1 family member sign it. So you could have 1 family member and perhaps a friend, a neighbor, or you could have your healthcare directive notarized. And as Jessica mentioned, there are some practices in place for safety and honoring social distancing. But as Jessica mentioned, even if you filled out this document and you weren't able to get it legal because of the social distancing guidelines, it's a great communication tool for your loved ones, for your healthcare decision maker. And if you are in a situation where you have a car accident, you're unable to communicate, it would be a great communication tool for a treatment team to honor your wishes. So I hope that was helpful. Again, keep the original document, share copies with your decision maker, your family, and your healthcare provider. And I'm happy to, if anyone would like to follow up with me, please reach out to the folks that are on the call. They can connect me to you. Happy to answer more questions. I know lots of questions come up with this topic, and we usually do a 1-hour workshop around advanced directives. But I'll give you sort of a taste of the reflective process that hopefully will help you as you move forward in your planning to fill out the document. And it's really detailed so that your loved ones will know what's important to you. So great. Thank you, everyone. And I'm going to give the baton back over to Rebecca, and she can close us out. So thank you, Rebecca.
Thank you, Kathryn, and thank you to all of our speakers. We hope that the participants found this program valuable this evening. During this challenging time, we're offering this exclusive content at no charge, and to support our work, you can continue to provide, so we can continue to provide meaningful experiences. You can donate at jewishla.org/give. Leah's going to put that in the chat if you'd like the URL. Thank you for joining the Federation's professional networks tonight, and have a good evening. Good night.